It was pretty rough. Basically, your intestines are inflamed, and because they're inflamed, you don't process food as well. So if I eat something, it would just go right through me, like literally within a day. And because it's so inflamed, it's like someone's just dragging like a knife across your stomach. So it was super painful.
Jimmy's diagnosis of Crohn's was earth-shattering. The weight loss, the loss of energy, all those facets of Crohn's attacked him really, really bad. And it was a pretty serious situation.
Even the biggest YouTuber on the planet isn't immune to health issues. In this video, we're going to take a deep dive into Crohn's disease. We'll look at what it is, the symptoms, the risk factors, and most importantly, the treatment and prognosis of living life with Crohn's. Jimmy Donaldson, also known as Mr. Beast, might be the most well-known man on the planet living with Crohn's disease. He has been very open about it, but has used his platform to spread awareness of what is sometimes called an invisible illness, because people living with Crohn's often appear completely healthy to those around them. And it's not only Mr. Beast. Pete Davidson has been living with Crohn's since he was a teenager. Actor Shannon Doherty of Beverly Hills 90210 has Crohn's, and so does Mike McCready, the lead guitarist of Pearl Jam. Have you ever heard of Crohn's disease before, or do you know anyone living with it? Crohn's disease falls under the category of inflammatory bowel disease. Inflammatory bowel disease, abbreviated IBD, is an umbrella term for chronic conditions that cause inflammation in your gastrointestinal tract. The gastrointestinal tract is the long tube, also known as your digestive tract, that runs from your mouth to your anus and is responsible for breaking down food and absorbing nutrients. In IBD, the immune system malfunctions and starts attacking the healthy tissues in your GI tract, leading to inflammation. The two types of inflammatory bowel disease are Crohn's disease and ulcerative colitis. These two diseases are differentiated by the location of disease and the layer of the intestines affected. The intestines have several different layers of tissue. Crohn's disease can cause inflammation anywhere along your GI tract, but most commonly targets the small intestine and colon, and it has the ability to affect all layers of the bowel. Ulcerative colitis only affects the inner lining of the large intestine and rectum. Both Crohn's and ulcerative colitis cause similar symptoms, including abdominal pain and cramping, diarrhea, which may be bloody, the urgent need to have a bowel movement, fatigue, weight loss, and rectal bleeding. Although symptoms may be similar, here are some of the key differences between the two diseases. As mentioned, Crohn's can affect any part of the GI tract, while ulcerative colitis is limited to the colon and rectum. Crohn's inflammation can penetrate deep into the layers of the bowel wall, whereas ulcerative colitis affects only the inner lining. And fevers are more common with Crohn's disease. The exact cause and triggers for inflammatory bowel disease are unknown. However, having a family member with IBD increases the risk of having the disease. Researchers have also suggested a faulty immune response may trigger inflammation in the GI tract and initiate the disease and symptoms. Environmental factors like diet, smoking, and certain medications might also play a role. Diagnosing inflammatory bowel disease involves a combination of clinical evaluation, laboratory tests, imaging studies, and endoscopic procedures. Blood tests like a complete blood count, ESR, which is your erythrocyte sedimentation rate, and C-reactive protein levels will be done to check for anemia and signs of inflammation. Stool tests are also performed to rule out infection with things like parasites and also to detect inflammation markers. A colonoscopy will usually be done by a gastroenterologist to allow direct visualization of the GI tract. Biopsies of the colon and rectum will also be done during this procedure. If further information is needed, CT scans, MRI, and intestinal ultrasound help assess the extent and severity of the disease. While there is no cure for IBD, several treatments can help manage symptoms and often induce remission. The primary goals of treatment are to reduce inflammation, relieve symptoms, and prevent complications. Medications are one of the primary treatments in inflammatory bowel disease. Aminosalicylates such as mesalamine help to control inflammation, particularly in ulcerative colitis. Corticosteroids are often used for short-term flare-ups to reduce inflammation rapidly. Corticosteroids are avoided as a long-term treatment due to side effects like weight gain, thin skin, adrenal gland insufficiency, and Cushing's syndrome. Immunomodulators are a type of medication that work by dampening the overall activity of the immune system. This broad immunosuppressive effect can help control the inappropriate immune response that leads to inflammation in IBD. Medications such as azathioprine and methotrexate modify the immune response and decrease the damage associated with inflammatory bowel disease. Antibiotics are used when needed to treat complications like abscesses or fistulas in Crohn's disease. And surgery may be necessary for patients who do not respond to medical therapy or who develop complications like bowel necrosis, toxic megacolon, or bowel obstructions. In ulcerative colitis, removal of the colon can be curative. In Crohn's disease, surgery typically involves removing diseased sections of the intestine, though the disease can recur. In addition to medications, lifestyle and diet modifications are important for patients with IBD. A balanced diet tailored to avoid trigger foods is crucial. Some patients benefit from specific diets, but since every patient is different, paying attention to what foods trigger flare-ups will be important with Crohn's and ulcerative colitis. It's often recommended to avoid high-fiber foods during flare-ups. Fatty and greasy foods can often worsen diarrhea and cramping. Spicy foods can irritate the digestive tract and trigger symptoms in some people with inflammatory bowel disease. Lactose intolerance is common in people with IBD. Dairy products like milk, cheese, and yogurt can cause gas, bloating, and diarrhea if you're lactose intolerant. Smoking cessation is particularly important for Crohn's disease, as smoking can worsen the condition. Techniques such as mindfulness and relaxation exercises can help manage symptoms. Unfortunately, IBD can lead to several serious complications. Intestinal strictures, which is a narrowing of the intestines due to scar tissue, are common. Strictures are dangerous because if stool cannot pass normally, it can lead to a bowel obstruction, which often requires surgery and cutting out the affected bowel segment. Fistulas, which are abnormal connections between the intestine and other organs, can develop, particularly in Crohn's disease. Fistulas can get infected and sometimes need surgical treatment. The risk of colon cancer is increased, especially in long-standing ulcerative colitis. Researchers have shown that people with inflammatory bowel disease have a 6 to 7-fold increased risk of developing colon cancer when compared to the general population. This increased risk does not mean people with IBD will get colon cancer, but screening colonoscopies remain very important. One of the scariest complications of inflammatory bowel disease is the development of toxic megacolon. With toxic megacolon, the colon becomes extremely inflamed and distended, with rapid enlargement and colon perforation is possible. Surgery is emergently necessary with the development of toxic megacolon in order to prevent colon perforation. Malnutrition and growth problems may occur due to malabsorption of nutrients and loss of appetite. And lastly, chronic inflammation and steroid use can weaken bones, leading to osteoporosis and an increased risk of bone fractures. Remember that inflammatory bowel disease is often referred to as a silent disease, meaning most people won't know there is anything wrong. However, it can leave you feeling fatigued and run down. But you look at people like Jimmy Donaldson and know that Crohn's disease and ulcerative colitis can be treated and managed, allowing a happy, productive life despite the illness. I hope this information helped. Let me know below what medical problem you'd like to see covered next. Thanks for watching, and we'll see you next time.